Nothing really can stop Alzheimer's.
It happens to many of us on different occasions, forgetting someone's name or where we put the keys. But Valley Baptist Medical Center Director of Neurocritical Care, Dr. Ameer Hasssan, says that's pretty normal. But he says once you've reached 65 years or older and forget more serious things like your way home, it's cause for alarm, especially with the threat of Alzheimer's, a disease still not completely understood.
We know that there's destruction of certain neurons. There's these plaques and tangles that are created in the brain. There are certain genetic predispositions.
Former state representative Don Lee was found dead in a nearby field from the nursing home he was living at. Family members say the 79-year-old suffered from Alzheimer's. Dr. Hasssan says the disease affects short-term memory, which can lead to very dangerous situations if a patient is left alone or suddenly goes missing.
Alzheimer's patients should be treated just the same as a child being abducted or a missing child, because they are at harm to themselves. They can walk into things, they can walk across the street and not pay attention to their surroundings and get hit by a car, for example. It's very dangerous for them to go out and be alone without supervision.
Dr. Hasssan says once someone is diagnosed with the disease, their lifespan is about 7 years, or for a few 3%, that can be up to 14 years. But Hasssan says once the disease grabs a hold of someone, it gradually worsens, killing off neurons in the brain.
Behavioral modification therapies that can be done to help Alzheimer's patients, little things to help them trigger a memory in order to know to ask for help, for example, signs at the door, signs at the bathroom, things like that, that kind of trigger that memory, let me make sure that someone can help me before I leave this door.